the program Delta Women's Drumbeat, the right time for yet another educative topic. Today our focus is cervical cancer. Ama Oneo is my name. I'll be back in a bit.
Education is power that controls success. Do you want to know the principle and educating one on how to apply those principles? Join us on Delta Women Drumbeat. Delta Women Drumbeat, the voice for us all.
Welcome back. Topics have been rolling in. The program is still open for more contributions. If you have any topic you would like us to discuss on the program, do send your suggested topics to the number 09032174129, 09032174129. You stand a chance of winning a recharge card if your topic is the winning topic for the week. Let us join our guest on the topic for today, cervical cancer. She is Dr. Uche Okwe, member of the Medical Women Association of Nigeria, Delta State Chapter. Happy listening. You're welcome to the program Delta Women's Drumbeat.
Thank you very much.
All right, this morning, doctor, we'll be looking at the topic cervical cancer. What is cervical cancer?
Cervical cancer has to do with cancer of the cervix. It is as a result of an abnormal growth in the area of the womb, that is the neck of the womb we call the cervix. And then this abnormal growth has to do with the abnormal growth of cells around the cervix. These cells, when they grow abnormally, could cause an invasion around the body, which could result in serious illness we call cancer.
Alright, so what causes cervical cancer?
Cervical cancer is mostly caused by a virus we call human papilloma virus. It could also be as a result of other problems. We now find we are having HIV, we have chlamydial infections, we have sexually transmitted infections, as we commonly see women who have sexually transmitted diseases with this kind of cancer. So in other words, the human papilloma virus with all other forms of infections could give rise to cervical cancer.
So what are the risk factors?
We have so many risk factors. Early exposure to sex. We find when a girl is exposed to sex early in her life, like from 9 years, we find that such women will commonly record cervical cancer. We have cases of women who are also prostitutes who we commonly record cancer of the cervix. We equally have people who have a high risk of promiscuity. If the husband of the lady, who may not actually be promiscuous, if the husband of the lady is promiscuous, having multiple sex partners and all that, it could result in cervical cancer. Then smokers. We find that a lot of our women smoke. We have had issues where smoking could also cause cervical cancer. Then of course poverty. We equally know that when you are poor, you cannot access treatment from anywhere. Of course, the person is likely to die of cancer. So those are some of the risk factors. And then for women who have multiple sex partners, you are probably married and then you have to go around from one man, Mr. A, Mr. B, Mr. C. These are women who we actually record cervical cancer, and it's actually common in those women.
So how common is it in Nigeria?
Well, it's very, very common. Globally, initially we start with the global trend. 471,000 women annually is usually recorded for cervical cancer, among which the 231,000 of these women are in Africa. And then coming down to Nigeria, we find that about 80,000 women, 80% of women from the 231,000 people that is women I have mentioned that have cancer, actually have cancer in Nigeria here. 80% of them. So we equally find that it has become a global problem. It's become not only a Nigerian factor. Then coming down to our states, we have had reasons to record in 2008, 2009, cervical cancer among our women. It is the second most common cancer in women in Nigeria. It is actually very common in the south. That's the second most common in the southern part of Nigeria. And then in the north, we find that cervical cancer is more common over there compared to breast cancer, which is the first common one in the southern part of Nigeria.
So what are some of the symptoms of cervical cancer?
Cervical cancer, most of the time the women complain of postcoital bleeding. After having had intercourse with their husbands, they come down with bleeding. They are not menstruating yet, they are bleeding. We equally have intermenstrual bleeding. Aside intermenstrual bleeding, we find women complain of foul-smelling discharge from the vagina that has been treated several times and it has refused to go. Aside that, some of them could complain not bleeding this time, but greenish substance coming out from their vagina. Those are because some of them could also complain of loss of weight and waist pain, inability to have sex without pains. Those are some of the symptoms we record from cancer.
All right, so how can one be tested? How can this be detected?
Well, the detection is very easy. We have various tests we use in detecting them now, like the PAP test. This is a very important test used to test women, and you get it, that is, you detect early. We equally have the one we call the visual inspection with acetic acid and villi. This is actually the one we use for a large crowd of women, where you have to get or reach a lot of women. So these are common tests. These are basically two tests we usually use to check. We also have the one we call the colposcopy. This is actually the ones where you come to the hospital and we go further to check if indeed this lady who they say has a pap test that is positive has cancer. We want to know where and how the cancer looks like. Then we of course go into that. But the basic test we use for women generally is the pap test or the VIA.
So cervical cancer is curable?
Yes, it's curable if detected early. If you detect late, most of our women come in when the stage is stage 4, where it is almost terminal. And in such cases, we cannot really do anything. But when it is detected early, if a woman comes into the hospital and comes for just general examination and you do the test, you'll be able to find out if she has cancer of the cervix or changes in her cervix.
So are there vaccines for cervical cancer?
Yes, the good news is that there are vaccines. We call them human papilloma virus vaccines. They are very much available now, and we are asking our women to assess it.
So at what point in time should a woman go for it?
Yes, we actually do the HPV vaccine for women between 9 to 26 years. For women between 9 to 26, a lot of women have come to us to say, even though they are 45 years, they want to actually have the vaccine. We usually advise them to do a pap test first to know if there are abnormal changes already in the cervix. And then if you don't have abnormal changes in your cervix, then we cannot actually give you a vaccine, HPV vaccine.
All right, so what are some of the treatments? Are there side effects when the treatment?
Yes, the treatment for cervical cancer is actually immediately the person is diagnosed of cervical cancer. Of course, there are 3 modes of treatment. We have the chemotherapy, we have surgery, you have radiotherapy. These treatments are very expensive. That is why we are saying that if you early detect, it is easier to treat. For the VIA, for example, if you do a VIA and you find that a woman has obvious signs of cervical cancer, the abnormal changes immediately you see, you can do a cryotherapy and that treats it immediately. But should in case the pap test says the woman is already having cervical cancer grade 1, grade 2, we advise that the woman should have a total hysterectomy, have the uterus and the cervix removed, because cancer of the cervix can easily spread to areas around it, directly to the uterus, directly to all the regions around it, the rectum, the anus and all that. So you advise that she should have a total hysterectomy, that's remove the whole of the uterus and cervix, and then go for chemotherapy. The chemotherapy is just a group of drugs that are actually formulated to take care of cancer of the cervix, and these drugs have side effects. They could cause loss of hair, loss of weight, immunosuppression, which can make the woman very ill, even though she comes out of it well. We always advise for 6-7 weeks the woman is on chemotherapy, and it's not an easy experience. And then of course radiotherapy. Radiotherapy are just specialized x-rays used to treat and destroy the cancer cells. Those are the modes of treatment. All right,
you just mentioned that it's very expensive.
Yes.
And some women who are falling victim of cervical cancer are finding it difficult to go through this, the processes. What do you think the government can do to help in that area?
Well, the government on its own is actually trying, but they need to do more. What they need to do is to sensitize women. If, like we are doing now, trying to sensitize women, that women who, wherever they are, come out from where they are and then assess treatment, go to the hospitals to have a common pelvic examination done. There are so many hospitals in the state where you can actually do a pelvic examination. If you have friends who are doctors, you could easily go to them and ask that your cervix be examined. You do a VIA. In that way, you are actually assessing the treatment or the detection. You want to know how your status, what your service is. In most government hospitals these days, after 6 weeks of delivery, they usually advise that you quickly go ahead and have your pap test done. They do it in UBTA, they do it in a lot of hospitals, even here in Delta State. So why not assess this treatment? It is not expensive just to do an ordinary screening. It is not expensive.
All right, so what would be your general advice to persons just listening and just hearing cervical cancer for the first time, and also to patients of cervical cancer?
Well, I'll advise anybody hearing about it to quickly make a move, assess, go to a hospital where you can assess a doctor to do your pelvic examination. A simple test alone can actually save your life. Another thing, for those who already have it, all time is not lost. You can go ahead and have your basic treatment and still get better. If indeed you are having a postcoital bleed and you are in your home, you are not supposed to be there. You should actually go all out to assess treatment in the hospitals.
I want to say thank you so much, Dr. Okwe, for educating us on the program today.
Thank you very much.
Welcome back from that interview with our guest. No work. Welcome back from that interview with our guest, Dr. Uche Okwe, on the topic for today's cervical cancer. Let us listen to our usual contribution from the public. Hi, welcome to the program.
Thank you very much.
Our focus is cervical cancer. Do you have a knowledge about it?
Yes, I know someone really very close, someone close to my heart who died by it. And as soon as I got to know, I had to make findings. While I was in Lagos, it was all over the place, the awareness. But at that time I was pregnant, so as soon as I had stayed 6 months after delivery, I started asking again. I know the vaccine is expensive. If it was cheaper, then we'll know that a lot of people will buy into it. But when people hear the price, it's just like, no, I'm safe. God is. But really, I think every lady should have the vaccine. There are two different schools of thoughts. Some people think 9 to 15 years is apt for the vaccine. But there are some other doctors who believe once you have the test done, the pap smear, and once it's done, you don't have it, then you go for the vaccine. And if it's detected early, it could be chunked off. So some people, they shy away from the detection and they don't want to even talk about it or faith in it. But God has provided these things there. Let's make use of it.
So you've actually taken the vaccine yourself?
Yes, I did. And funny enough, I didn't do the test because the price they were telling me, I didn't have it at that time. I just thought to take the vaccine. I'm not saying that's what we should do. I would not advise for that. But I did that because when I have the money, I'll go do a pap smear. But for now, I just thought, why not I take the vaccine and get myself protected? I'll check.
All right. Thank you very much for coming.
Thank you.
Doctor, you're welcome to the program.
Thank you very much. Thank you for having me.
All right, we're looking at cervical cancer. What do you think every woman should know about cervical cancer?
Okay, let me start from saying that cervical cancer, it's cancer of the cervix. The cervix is the end of the vagina, but the beginning of the uterus. It's like a tube that connects the vagina with the uterus. The uterus being the part where the baby stays, you understand? So, cervical cancer is the second most common cancer in women after breast cancer. It's just that in our environment, is not the enlightenment people have about it is not widespread. Understand? So usually, what we say is that every woman that is sexually active should go and do a pap smear. It's actually is a short form of Papa Nicolau smear. It's a scientist actually invented. A Greek scientist actually invented the smear, which is a procedure to find out if any cell in the cervix is transforming from being a normal cell to cervical cancer. The major thing about cervical cancer is that early screening is key. And also there are vaccines out there that you can take, that every female child should take to prevent cervical cancer. There are different stages of the cancer which due to time constraints we cannot really delve in. What I advise every woman for is that once you're of childbearing age, you should go ahead, go to a hospital, tell them you want to do your pap smear, and they do a screening for you, and we check if you're predisposed to having cervical cancer.
I want to thank you so much for contributing on the program.
Thank you very much for having me too.
Delta Women Drumbeat is the program. In case you're just tuning in, 09032174129 is the number to call or send you messages to. We're on WhatsApp on BBM. Our pin is 7A4FECB9. 7A4FECB9. Click on the like button on our Facebook page at www.facebook.com/Delta Women's Drumbeat. On Twitter at Delta Women, and on YouTube at www.youtube.com/Delta Women's Drumbeat. Check out the activities of the NGO at www.deltawomen.org. Registration is in full swing for the NGO's free entrepreneur training starting on the 6th to 24th of October 2014. To register, call our number 09032174129. This is strictly for women in business. Our next stop on the program is our talent segment, where you get the opportunity to shine with your God-given talent in business, entertainment, arts, etc. for free. Call 09032174129 or our BB pin is 7A4FECB9. 7A4FECB9 to be part of this segment. Our artist for this week is Sam V, Godman, with a song titled G for Zion. Enjoy it.
That man from Zion, they call me a Godman, me a dangerous. They got a Holy Ghost fire, me strike like a thunder, me a dangerous. Man a bad man from Zion, they call me a Godman, me a dangerous. They got a Holy Ghost fire, me strike like a thunder. Hey, no be moi, no be beans cake, no be today, now we dey relate. But I still give God all the praise for making me see today. Many don't pass away. Back then in the hood, many G's died. No be smart thing for all of them to see the light. But thank God, me I see the light, me I see Christ. Now I'm glad I'm living a fulfilled life. If no be God, I for don't go. All my enemies, they for don't blow. But right now, man, I'm on the microphone, telling young G's never try this at home. The best thing they say in life are free. Life is a gift, so you don't have to fight for it. Cause if you fight for it, you gon' die for it. And when you die for it, you get 6 feet. And when you get 6 feet, your history. What is history? Your book in a bookshelf, filled with many dust, many spider webs. Your mother's tears not forever, only for a moment. You wanna leave, follow my lead. We got our own crew and our own rules. We are gentlemen. But when the devil comes, man, a bad shot guy. Man, a that man from Zion, they call me a Godman, me a dangerous. Me got a Holy Ghost fire, me strike like a thunder, me a dangerous. Man, a bad man from Zion, they call me a Godman, me a dangerous. They got a Holy Ghost fire, me strike like a thunder. Hey, man, a bad shot man from a Zion. When me I walk like a lion. It's I show the eye, man, I feeling so fly. Everybody come around them, I wanna ask why. Man operating a different kind of rule that the man born for man go fit abuse. Don't wanna be like me, feel free to follow through. Cause we got our most high and is leading me through. Yes, I'm so blessed, my heart at rest. It's what is best, I put it to the test. I don't fear nothing else, cause I know I'm blessed. Conformed in this image you can contest. And when I declare, yes, it comes to pass. Ain't no obstruction, my brother, no protest. No power failure, steady supply. All I do is rule the world and my spirit stays high. Come on, speaking tongues, speaking tongues. Break the chains, break the bond that's been holding you for long. When I'm weak, he makes me strong. In the shield I belong. My security, my horn, I say a word and it's done. I'm in need, he supplies, I'm on call, he replies. His word is my wings, so I'm gonna fly. Fly above and the shackles of my enemies will want see me delete. See, man, I that man from Zion, they call me a God man. Me a dangerous. Me got a Holy Ghost fire, me strike like a thunder. Me a dangerous. Man, a bad man from Zion, they call me a God man. Me a dangerous. Me got a Holy Ghost fire, me strike like a thunder. Hey.
I want to say thank you to everyone who spiced up this week's episode, to my boss, Elsie Jorogun Reed, Sarah Kamara, my producer, the Medical Women Association of Nigeria Delta State Chapter, volunteers of the NGO, and the crew of Delta Women's Drum Beat. Keep a date with us, God willing, same time, same station next week for yet another interesting episode of Delta Women's Drum Beat. I'm Aonayo, is my name. God bless. Bye-bye.
Delta women stand up, make we put our hands together to make the testing better. Now him be our dreams. Delta women's drum beat, no shaking at all.